presenters to go back out there at this stand and talk to their peers and give information on drugs that is scientifically based and aimed to help prevent health consequences, negative health consequences. My project that I particularly coordinate is Pink Unity, which focuses specifically on visitors of gay club nights and fetish parties, and has a specific interest in, or a specific, we focus especially on the intersection of drug use and sex, so drugs in a sexualized context. And our outreach is a little less sunny. We are mostly in like dark corners, talking to people one-on-one, giving them little quizzes on drugs as a conversation starter. And of course, all our peers are also from this scene, so it's quite easy to give information to your friends and people who could be your friends. But then I'll continue to party drugs and harm reduction. So the basics that we always cover when it comes to any kind of drug are, of course, factors determining the effect of the drug, where young people who are just starting to use the drug need to know that the drug, like what kind of drug are you taking, how much are you taking, and are you combining it with anything else, are of course important. But equally important for the effect that you're feeling is the set. How is your health? How is your mood? Are there any physical vulnerabilities that you have that might interact poorly with the drugs you're taking? And the setting, which is who are you with? Where are you? What's it like there? And if something is going wrong or there's an undesirable effect of the drug, once you've ingested the drug, you cannot really change that anymore, but you can still change, for example, the setting the easiest. Route of administration, we're always, if the conversation leads to it, we try to steer towards oral ingestion or snorting rather than smoking or injecting, if it's at all possible. And then, of course, there's also this little check of motivation of use, where, especially in recreational settings, there's also this sort of low-key normalization. Like, we are at this party, we are at this festival, of course, you're going to use ecstasy. Where you can also check at sort of individual level, like, what are you trying to get out of your drug experience, and are you getting what you're trying to get out of it? If so, maybe try something else if you're not getting what you want out of your drug experience. And then basically we go into specific drugs where we classify them in 3: uppers, downers, trippers. Uppers, stimulants, give you energy; downers, sedatives, relax you; and trippers, psychedelics that cause mind-altering effects. And of course, the classic uppers: cocaine, speed, mephedrone, crystal meth. Classic downers: GHB, alcohol, heroin. Classic trippers: LSD, 2CB, magic mushrooms. And then ecstasy, MDMA is a bit in between an upper and a psychedelic. And ketamine and cannabis are a bit in between the classic sedatives and the more mind-altering, experience-altering drugs. But for the specific drugs, due to time, I'll just concentrate on these 3: speed, ecstasy, and GHB, what we tell people and what you can know. Starting with ecstasy. So ecstasy, MDMA, how do you come across it? Usually it's in colorful pills. Netherlands is one of the biggest production countries of ecstasy in the world, and we ship worldwide. And the amount of variations in colors and logos and things I've seen over the years in ecstasy pills is astounding. It's usually taken orally, so people swallow a quarter of a pill at a time, and the duration of the drug is 4 to 6 hours. It gives energy, euphoria, it makes you want to move, it makes you want to touch people, it creates feelings of connection, of love. And the trends we're seeing are that, well, the use of MDMA has been around for decades. It's been quite normalized under young festival goers, that ecstasy is just something that you use, and no more stigmatized. Well, the stigma is coming off. And of course, in the market of MDMA and ecstasy pills are really highly dosed. Like pills contain on average 180 milligrams of MDMA, and some are upwards to 220, 250, which is really high. And one myth that won't stop, which is always one of the basic information we give, is MDMA. Ecstasy pills contain only MDMA and a coloring agent and like a filler agent, but there's no speed in ecstasy pills, maybe in like less than 1%. So if you're going too hard on your ecstasy pill, you've probably just taken too much MDMA, and you don't have an adulterated pill. Acute risks of MDMA, of course, the hangover, in Dutch, the dinsdag dip, the Tuesday dip, where you're just exhausted and depleted of your serotonin and you feel like shit. Overheating, because MDMA causes your body temperature to rise, especially if you combine it with dancing on poor ventilated areas and heat-trapping clothing. Water poisoning, because you produce less urine, and then if you start drinking a lot of water with it, you have no way to expel the water from your body, and your blood vessels your blood cells can swell, and water can get into your lungs and brain. And of course, overdose. If you just take too much MDMA, you get the serotonin syndrome, which also creates overheating. But yeah, which is seen as overheating and these other symptoms. Long-term risk, of course, brain cells that respond to MDMA can die, and HPPD I won't go into, but cardiovascular problems, of course, can arise by chronic use. What we tell people that come to our stand is, like, of course, don't use too much or too often, and we give guidelines of roughly 6 to 8 weeks between use, and like a maximum of 1.5 your body weight in kilograms in milligrams. So I'm 70 kilos, my max during a day would be 100. And then to avoid water intoxication, maximum 1 glass of water per hour, and to avoid overheating, to chill out and cool down often. And of course, prepare, repair, make sure that you're in a good mood, in a good, you've slept well, you've eaten well the days before and the days after using. For speed, it's just a white powder, snorted or taken in pills, like capsule, or like wrapped in a little piece of paper. It lasts longer. It lasts up to 5 to 8 hours that you feel the high, but the after effects can last up to 12 hours that you can't sleep or that you still feel agitated. It's just a classic upper, so it's creates a lot of energy and focus, but not much of this pretty world or feeling of connectedness. And the trends we see there with the drug checking service as well is that it's often cut with caffeine, and you have a really big variation between some powders are just pure caffeine sold as speed, others are pure amphetamine sold as speed, and all the variations in between. So it's really pays to have your speed tested if you buy it from a dealer. Acute risks of speed are of course, exhaustion. You just deplete your energy way more than you would without the drug. Again, overheating, overexcitation. If you take too much and you get into this excitatory delirium, where you're just unfocused, you can't really interact with the world anymore. And if you take speed for a long time and you lose sleep, of course, sleep deprivation can cause more psychotic symptoms and delusions and anxiety, paranoia, and such. Long-term users of speed run the risk of chronic fatigue and, of course, cardiovascular problems, and also problems with your teeth because you're clenching your jaw a lot. And here, where it wasn't with MDMA much, with MDMA we don't see much people developing addiction and going into addiction care. With speed, we see this more. With harm reduction tips we give to people when we're talking about speed, of course, not too often, not too much, but we don't really have guidelines here, and also to chill out, cool down. But with speed, it's quite, it's good to check if people are using it to self-medicate, like feeling down, feeling depressed, feeling fatigued, and then if they take speed, they can function again, and they can enjoy the party, where you can give the suggestion like, is there a more sustainable way that doesn't build tolerance, like maybe psychotherapy that could also help you with depression or fatigue? Like I said, have it checked for purity at a drug checking service if this is available in your country. Luckily in the Netherlands, drug checking is widely available. And one tip with all snorting drugs we say is don't switch snorting tubes because of blood-blood contact and blood-borne viruses. Lastly, the one I'll talk about here, GHB, which is a clear viscous liquid, very unsexy drug to photograph because it's just a clear liquid. Often in these little tubes of 5 milliliters, which is about two starting doses. People take it orally, they mix it in a drink, they drink it, or booty bumping is also quite, or is popular among certain subscenes, like gay men who use it in a sexual setting, where you take a syringe without a needle and you inject it into your rectum, so it can go through the veins there and bypass the liver. So you get more bang for your buck. The effects are sedative, you slow down, you relax, and hypnotic, so you become more suggestible to whatever is going on around you. You become more agreeable to, which can also lead to situations where you agree to things you wouldn't if you were sober. And the trends we see that GHB has gotten a bad reputation in the Netherlands in general, with a lot of bad, like negative media attention. And so we see a decline in use among young straight users, like the people going to festivals that Unity speaks to. But especially in a sexualized context, among men who have sex with men and swingers, GHB is still quite popular for the effect and the intensifying effect it has on sex. Acute risks with GHB are very, like the most common, like the one for GHB is overdose, because the effective dose where you feel something versus the dose where you pass out and maybe slip into a coma or even stop breathing is very, very small. An effective dose can be, depending on the strength of your GHB, like 2-3 milliliters. And then if you go to 4 or 5, then you can already slip under and go into a coma and have to go to the emergency room. Nausea, disinhibition, motor problems, those are the bit less serious ones, comparable to alcohol. Your head starts spinning, you do things you would think twice about sober. And of course, the long-term risks with GHB, there's a high addiction potential. It's also a drug that if once you build an addiction and you get it to treatment, the chance of relapse are quite high, because the negative consequences for the user are not that apparent. If you wake up from a slipping under, you feel quite elated and joyful, usually, still to the effect of GHB. So people don't really associate passing out as a negative thing, because you wake up feeling refreshed. But GHB also has this, it works for 4 hours-ish, 1 to 3 hours, 4 hours. And so people who use it regularly, they start sleeping in very short bursts, and they have to redose to keep sleeping and to function normally. The harm reduction tips we give with GHB is very clear. It's very much about dosing and not mixing with other downers. So we tell people, get a milliliter syringe without a needle, and just measure on the milliliter exactly how much you're taking. Keep track on a pad, especially if you're in a group setting and everyone is using. Write everyone's name down, the time, the dose, and try to keep this this clear. Also, that you don't run the risk of losing track of time and redosing and then overdosing accidentally. And also, just do not combine with alcohol. And we see that this is very very well known among people who use GHB, like GHB and alcohol, no, but also GHB and other sedatives like benzos, no. Because GHB is made also in sort of home settings with strong acids and bases to normalize the pH, this can shift. So if you have GHB, it's always good to check the pH if you're taking it pure, so you don't get chemical burns in your mouth or throat. And we always, like with GHB, we do try to just to mention the addiction potential, that if you notice yourself slipping into habitual use, and you notice yourself slipping into sort of use out of boredom, it's a good thing to check for alternatives, because the physical dependency is quite strong. So I think this is the time I have, and then the rest is I'm looking forward to your questions and your personal experience and whatever you want to ask me about party drugs. But for later on, unity.nl, our website for our target audience, as well as pinkunity.nl for more the drugs and sex part for gay, bi, and queer men. They contain a lot of information per party drug on what it is, what the risks are, and what the harm reduction tips are. So if you're ever in a pinch and you need a quick resource for particular drugs, I do recommend this one. So then I'll stop